My name is Jonathan Cardon. I'm a dentist in Castle Rock, Colorado with Clocktower Family Dental, and I have a lot of patients who are very nervous and apprehensive about dental care, and that is something that we talk with patients daily about. Occasionally, I'll have a patient who comes in who has not been to the dentist for a number of years and unfortunately needs quite extensive amounts of dental work. And that's really where we come into play, is that we have assembled a team, an anesthesiologist and an oral surgeon, and with me being a restorative dentist, we are able to address most of the patient's needs in very few visits. The goal would be to try and minimize that number of visits for the patient to increase their comfort level, but also be able to do that work efficiently so that again, nobody loves coming to the dentist, but our goal is to help facilitate and expedite that process so that A, it's as enjoyable as it can be, and B, so that they can start to gain self-confidence in the way that they interact with the dental office, but also get them back to a state of health, which is what they are primarily concerned about. So that's really where I think we are somewhat differentiated from other offices. There are a lot of offices who offer sedation dentistry, but to the level that we're able to provide it, with bringing in an anesthesiologist who is highly trained, an oral surgeon who also is highly trained, and myself, who's done a lot of extra coursework to be able to, again, meet patients' needs and really meet them where they're at. Again, as a dentist, I have many patients who come to me and are looking for options to replace their teeth. And the options are varied depending on the specific need of the patient. And it's my job to help steer the patient in the right direction based on what their needs and wants are. Not everybody is the same as you would guess. And for some folks, what they're truly interested in is a popular technique known as a fixed hybrid denture or a screw-in denture or an all-on-X, all-on-4. These all-on-4 type of denture, this prosthesis or this treatment modality has lots of different names. And that's something that we have taken lots of training and coursework in to be able to help patients who are specifically interested in that treatment, a screw-in denture, to be able to accomplish. And that process involves typically someone who comes in and has what's called a terminal dentition, or meaning that their teeth are mostly not savable anymore. And the options typically, historically, have been you get a denture, which is not always the most comfortable thing to wear, and doesn't give you or give a patient their full chewing power. A patient who wears a traditional denture may only be able to chew at 10 to 20% of the level that they would with their normal teeth. There is another option called a snap-in denture, and that is a denture that is supported by implants. And that is also a good option for folks who are looking for improved chewing capacity and chewing function, where you may gain up to 50 to 60% of your chewing power. The ideal treatment, or the best treatment that dentistry has available to offer patients today, is that screw-in denture. And that is a little bit different in the sense that the denture is screwed in, it doesn't come out unless it's taken out by your dentist. The beauty of that procedure is that most of the time when patients come in and they have their teeth out, you will leave with teeth either that day or the following day. So you always have teeth. That's not always the case with other dentures. That is possible, but with this particular treatment, and the reason why it's so popular is because people literally leave with teeth that day or very shortly after. The other ideal advantage to this is that this is the most close approximation to a natural dentition that a patient can get, where someone can chew virtually with 100% of the chewing power that they had before. The aesthetics are much better in this type of prosthesis because it's typically made out of a porcelain material, and the aesthetics of a porcelain-based material is much higher than what you would get from a plastic or a denture, traditional denture or plastic denture would be. So for those reasons, these are very, very popular, and it's just important to know what your options are when you come in, and that this may not even be the correct option for people. I've had some people come in and want me to take out their teeth, and they don't need to be taken out. And so we will tell that to the patient that this isn't the best treatment for you because you have healthy teeth that may need a few different procedures, but by and large they should be able to maintain their healthy teeth, because the best implant you have is the one you were born with. So with that being said, if anybody has any questions, this is something that we are passionate about providing and taking and helping people get to the place that they need to be in a situation that's tailored to them and for them. As a dentist, the words I most often hear is, "No offense, doc, but I hate coming to see you." Being able to provide a service to patients where that makes a difference for them, both personally and sometimes even professionally for them, is what makes really all the other stuff that's challenging worth it. To be able to see a positive impact, and to see someone who maybe goes from not having a lot of self-confidence to then having a lot of self-confidence, and seeing that aura change about them is rewarding. And even patients who, I had one patient who wore a long mustache, and once we got because he was a little bit shy or embarrassed about the way things looked, after we got his teeth in, you just notice in the progression of photos that we take that something changed. And we don't always ask that, but we can definitely see that change in a person's confidence when they walk through the door and they're smiling and they're happy. And that is super rewarding as a dentist, to be able to see that, because not everything I do is that way. In fact, the majority of what I do is not that way. It's taking care of a tooth that needs a fix. But when you're able to reconstruct or give people something that they truly feel good about, you see it on their face and you see them smile, and that's definitely rewarding. And that makes the job, those are good days. That makes you feel good. And so I think, just as far as the question as how what we do impacts our community, I think it's something that you want your values to come through in your business, and the way you think of people and the way you interact with people. You realize that these are people that you live with. Oftentimes they're our neighbors, or they're people we go to school with or church with. And that's important, how we are seen in the community, how we portray ourselves. It's very important that we do our best to make sure that we are treating people in the best way possible, right? The way, as is said, that you would want to be treated. But at the end of the day, it's more than that. I want to go home and feel good about my day. And I want to feel good about my interactions with people. I want to feel like somebody, I had maybe a positive effect for that day. And over an accumulation of days and years, you hope that that helps in some way. And it's not going to be anything major, life changing in most situations, but I want that to be able to feel that way when I go home, that I had hopefully positive and uplifting interactions with people, and hopefully made them feel encouraged about where they are at in my own small way.